Welcome back to another episode of Keeping Ag Real. I am your host, Jenny Schweigert, and I am coming to you from the FBN Farmer to Farmer event in Omaha, Nebraska. And I have Lucas Strom with me right now.
Hey, Jenny, thanks. Right? Yeah, absolutely. That was right. Thank you for having me.
So for someone who isn't familiar with FBN, can you kind of just give a high-level, brief overview of what the company is about?
Yeah, absolutely. And the funny thing is I actually joined as a farmer before I ever came on board to work with them. So,
interesting.
Yeah, I joined as a farmer over 4 years ago. But what was always interesting to me before I even joined here is the fact that it's a different type of company. If you start thinking about it, we're really a purpose-built company we weren't married to a specific product or service, right? We were married to a mission that said, how can we improve the bottom line? How can we improve lives of family farms? And so that's all we do. Every time we ask ourselves what we do, or our farmers tell us this is what we want from you, that's what we do. And that's become not just analytics and agronomics, but seed and inputs, and now insurance, and crop insurance and health insurance. And so we have the freedom to just fully support our farmers regardless of what the industry is or what the business is.
So in the beginning, and I'm sure still now, it's definitely changed, with 3,000 people here, there was a lot of skeptical people about FBN. And now adding the health program, people are now skeptical about that. So break it down for me. I know nothing. Tell me what it's about and what it is that you're hoping to achieve with this program.
Yeah, well, I think most importantly, skepticism is healthy. If somebody wasn't skeptical of something that was different or something that was new or sounded too good to be true, then I would be surprised.
Right.
Skepticism is different than like a unhealthy level of conspiracy theorism. Sure. But ultimately what we're doing here is trying to leverage all the farmers together collectively, buying power, selling power, information power, and how do we actually create value out of that? I'm a data technology guy by background, and everyone talks about data. Data is not valuable. Data is only an expense. We've only spent money creating data. It's how do you actually turn that into information?
And if you don't understand the data, it's useless.
What most farmers do is, and this is what I did as a farmer, and I signed up 4 years ago simply so I didn't have to use clean data on the weekend after I was done harvesting or planting, right? I just didn't want to spend the hours on the weekend. I wanted to go out with my wife, so I said, I want to pay the money to have a team of people just clean it, fix it, load it, and that's done. So this whole idea of creating information out of the data is what we do on everything. Price transparency. It's a data point for a farmer to know what they paid. It's information if you know what thousands of farmers paid for it. I can only learn so much on my farm on hybrids because I can only plant so many hybrids.
Right.
But it becomes really powerful information if I know what everyone else is doing and what might work. I mean, I've changed what I've done multiple times on my farm operation because of information that someone else put in anonymously into the network.
And I think for me, I didn't quite get it until coming to this event, and now it clicks and I see what the benefits, and I'm not sure how to translate that to people who aren't here. I would just encourage that if they can in the future to come to the next event because it's really impressive and mind-changing also. So the healthcare program, where does this start? Are you the actual insurance? Are you the go-between? How is this working?
Yeah, it's a great question. So we are not reinventing healthcare, and as I said, I spent 15 years in healthcare. That was my profession before coming to FBN. It's very complex. It's employer-based. It's a political ragdoll. We're not going to reinvent something that experts have been spending decades trying to figure out. But what we can do is figure out what we've done is partner with a plan. So we've partnered with somebody that exists out there that our farmers could go directly to, but we've actually been able to negotiate lower premiums, like 10%, 5 to 10%, depending on where you are. below what you could go directly to at this plan. And
because of the number of members.
Exactly. I mean, we've
It's
been
kind of like a gym membership for a corporate rate.
We're leveraging buying power of the network. Our farmer. This is by far the easiest way for anyone to get a hold of a large group of farmers at this point. So we're not an insurance company. We don't have licensed agents. Our partner is the expert in this. We have an affinity relationship or a marketing relationship, and we're a distribution arm. So our farmers, on behalf, and I told them this morning in my keynote, we closed our first policy. We just did this 7 days ago. We've had like 1,200 inquiries, and we get like one every 3 minutes. And it's a combination of members and non-members. Because non-members are like, well, I've been skeptical of FBN, but if they can actually save me on healthcare, then okay, maybe they're not all that bad. And so I told them this morning, our first policy was underwritten yesterday, and that Nebraska farm family.
All right, that one's over.
It's a group insurance. The husband and wife qualify. That group insurance, they save $900 a month. They're going to save $10,800 this year alone.
Perfect, yeah.
And they're like, well, is it worth the $700 FBN membership? If you're thinking about becoming a member, it's paid off 15 years in the first year. So ultimately, the last 4 years, they have asked us.
We're trying to find
Farmers asked us for 4 years, help us figure something out, and we've been working hard for like the last year and a half trying to figure this out. So far so good. We're going to make it better. We can continue to leverage the network as it grows.
Excellent. So I also have Jerod McDaniel here, and he has some questions for you about his family and how this can help their family.
Hi, Lucas. How are you?
I'm doing well, Jerod. How are you?
Not bad.
Nice to meet you.
Yeah, nice to meet you again. A couple times. Yeah, I have a question on just like how is this all going to work with farm families, my family in particular?
Yeah, absolutely. I mean, just what's the experience like? So we have FBNHealth.com. You go there, you enroll online, you talk to somebody. It's a quick enrollment process. It will take somewhere between 3 to 6 days, depending. You get an answer. You figure out there's 3 main questions to answer if you're a farm family. Is my provider in network? Can you cover who I'm comfortable with working with? Or maybe you switch. Are you eligible? Do you meet eligibility requirements as a family or as an operation? And then ultimately, where's the premium come in? Is this going to save me money? Because it doesn't mean it's always going to save you money, right? Well, I explained earlier this morning, this is not a perfect solution. But we put a stake in the ground. We've been asked about it for 4 years. We put a stake in the ground. It's going to work for a portion. It's already worked for someone. We had our first policy written yesterday, and it's going to save them a lot of money. So we can make this better. As it gets bigger, it gets stronger. We can change the eligibility requirements. We can lower premiums. That's how it works. So you're going to go to our website. Our partner is our partner that administers this. They've been doing this a long time. They have 65,000 lives covered already under their plans, and they're going to take care of you.
What is your biggest challenge, Jerod, with the current insurance situation in your family?
I think right now the biggest challenge that I see is actually keeping somewhat of the coverage that we have, where you can go most anywhere. You're not going to end up in out of network crazy, semi loophole where you end up with holding all the bill. That's kind of what's out there now is if you leave your insurance that may be high, but it covers everything, where are we going to? So now we're in the challenge of how do we go decipher all this stuff? And we feel like we're trying to end up in a insurance expert. But
Jerod brings up a great point. So I have to, he has to be an insurance expert because he doesn't have a support structure. I mentioned that our whole health system is employer-based in the U.S. All these large companies, all these employees, they have teams of people that can answer questions for them, help them out, direct them. What's the right decision? Do I do a high deductible? Do I not do a high deductible?
HR.
Right.
There's human resources. We don't have human resources.
So you have to, again, we talked about it earlier in the conference. A farmer wears literally 30 hats. And why do they have to wear the healthcare expert hat? FBN, the role we can play.
And do you have time to wear that hat?
Yeah, you don't have time for that. So FBN, with our partnership, can help provide a little bit of, we're not the employer of, but we've created this virtual network where we can create a little bit of infrastructure, provide education, provide a hotline, provide services, get feedback. If we want to, if Jerod says, I would love to do this makes sense, but my provider's not in network, I'm going to go right to our plan partner and go, we need to go figure out who his provider, what provider network he belongs to, and go get a contract done with them so we can turn them from out of network to in network. So I might not be able to service him today. Maybe we can service this tomorrow or next year. So that's where farmers through our network have a direct feedback loop to someone that can actually make changes to plans, and it gets them that much closer.
Yeah. That's pretty cool, because any other time you call an insurance company, it's kind of a joke. I mean, when you deal with them now,
two people or three people.
Yeah, I mean, you might call a rep and they'll get you to somebody, but when I was investigating health insurance, I called the main number. They said, well, you have to talk to benefits. So they transfer me to benefits. Benefits tells me I have to talk to sales. Sales says you have to talk to the original operator, and so you end up in this circle trying to just get answers.
Well,
and
it's worse than that.
Yeah.
When you call and they say, who are you, or what's your group number, and they realize that you're calling on behalf of 6 people or 8 people, they're less interested to support you. You're not a employer that has 200 employees where they really want to make sure that service is right.
Or I'm just a family, just as an individual, an individual that's in a quote group, but it's some weird, maybe it's probably just everybody in our zip code or county. I mean, it's not, the idea of a group, the way they put it, isn't even realistic.
So now when farmers call into FBN Health, they know that they're calling in as part of the FBN network. So when we get 10,000 lives on this, you're calling in, there's some backing there.
Yeah. So Jerod and Julie have like 15, 16, 17 kids or something like that. I don't know.
Mm-hmm.
We lost count. I
didn't even know. Is it still going, or they?
I don't know. I don't know if that's.
We lost the password. We no longer have any more kids.
Goodness.
You could edit that out, or you can leave it in.
I'm not editing.
Oh, there you go.
This is live streaming.
This is going to be unedited.
That's fine with me.
Based off of our panel that you and I were on yesterday.
Really?
I'm going to go uncensored today.
Awesome. I think you'll like it.
So with that many children, is there anything that makes the policy different for them?
Here's the best thing, and I feel like I gave you a loaded question to ask, but this is really unique to the plan and the way it's designed. It's a husband and wife, it's a subscriber plus one, it's a plus one children policy, which means it doesn't change your premium if you have one child or if you have 10 children, believe it or not. And it's just the way that it's set up.
You can go find that password now.
Yeah, we can.
Yeah, so keep adding them.
Just start picking them up off the street. We got one more.
Hey, I got you free healthcare. Come in.
There's healthcare over here. You just jump in.
Just need to walk the fields.
At this point, we will actually need a short bus. We don't have one yet, but that would be the next.
I'm not
step.
going to go to the short bus discussion.
It's a softball.
That is a softball.
No, I'm excited. It may work, it may not, but at least, and Lucas and I have talked about this. It's another option that's on the table, and and that's the thing about FBN is they haven't been afraid to, at least when they said that we're going to do it, they actually did it. And kudos to you guys, because a lot of people talk the talk, but this was just like a lot of things. It's kind of a defining. We're going to do it. We're learning as it goes, but a lot of people, they just say, well, not my problem. And that's it.
I respect the transparency, very much so. That, hey, we are learning as we go.
Yeah.
There is no perfect answer. It's progress. How can we provide progress?
Jerod, you and I were talking earlier about the concern of leaving your current plan and maybe you jump onto the FBN Health, you're not happy with it, and you want to go back, but you've lost that plan.
That's we're on an old plan with it actually has really good benefits, coverage, everything else, but in the way the insurance companies have went about dealing with that is they just raise the premiums till eventually you get off. I mean, they're trying to run you out of town essentially, but if you ever leave, that door's closed. And so what happens is you start looking at the alternatives and you find all those open loopholes of out of network, and this is, from my understanding, every plan that's issued in this next coming year, out of network has unlimited deductibles. So if you end up having a car wreck and going into the wrong hospital, somebody, the ambulance take you to an out-of-network provider, you could be really open-ended on some coverage. And those are little things that you find. So it may be a pretty good plan, but there's all these things that, is it really good in the event that you need it?
So I would imagine that their family is not the only family in that situation. So what is FBN going to do when you possibly have somebody that isn't getting exactly what they thought they were going to get out of the plan?
Yeah, I mean, you bring up a good point. So we have a lot of issues with healthcare. So what that creates is a very fluid environment. Things change. It's an annual decision we make. We can continue. Do I stay the same? Do I do the same? The prices change. At what point do I make it a different decision? So if you think about this, we have a direct feedback loop from our farmers to our plan, and we're not trying to kick people off. We're trying to get people on, right? Because as we grow this group, it's more powerful. So if our farmers have these issues, and this conversation about grandfathered plans I've heard 20 times today. If it makes a decision to stay there this year, great. If the decision, because we can change some things next year and we're better, but what I can promise you is we wake up every day trying to figure out how we can make this better and not try to kick farmers off because there are 4 people that we don't care. This is about 10,000 farmers.
Yeah.
This is about, I showed a slide this morning. I estimate we're 60 to 75,000 lives, people that are involved in the operations from our employees, from our members today already.
Yeah. Well, I know one thing about, you talk like this plan that we have, I've been on it so long, they actually couldn't print, they didn't have an electronic email copy available to send to me. I've been on 25 years, I've had the same insurance plan with the same company. And so in that amount of time, instead of making it better, offering something else, they just tried to belittle it, essentially, like make it less and less effective with their new offerings.
It's called sunsetting. They're trying to sunset that plan.
Well, yeah, I'm sure it's an actual thing, but it feels like, I don't know how many people have stayed as long as I have, but I'm still, they'd be happy if I was gone. They'd be like, see ya. So
it's almost like a pride thing. You're like, I'm not going anywhere. You're never.
Well, and it's also like the devil you know is worse than the one you don't at this moment, because I don't want to step off until we're absolutely sure.
So just go through a detailed enrollment, figure out what the numbers look like, figure out what the providers look like, see if it makes sense. If it does, it doesn't.
And I promise you, my wife Julie she's that person that will look at every little thing, and if it's not there, she'll be like, nice try, Cowboys, let's go again. But that's what you really need, is someone who's going to say, no, this is what I want, period. And if it doesn't work, you got to have someone that says, not it's kind of okay, no, it's this is what I want. And that can be very firm. Boom, there you go.
So
Absolutely.
How are you going to handle, obviously you said, just in the last week you've had 1,200 inquiries. How are you handling that? Who's answering those inquiries? And
well, remember, our partner has a service center, right? So our partner has 65,000 lives under management already. This is not a startup healthcare program. What we're doing is creating a conduit that farmers can go underneath one type of pooled risk, essentially. But our partner this is what they do. They've done this for a long time. This is not we didn't hire people last week and now they're figuring out what
I have a question for Lucas. You always hear the term, the PPO, HMO, but like all these terms to define insurance. Does this have like an acronym attached to it, your insurance?
No,
not yet. They're working on that.
Yeah.
Okay.
FBN, no.
That's
PPO, HMO, FBN, there we go. No, like HSA, health savings plan, there's this health savings option. One of the 4 medical plans is an HSA. Okay. The other ones we just say are low to high deductible. When you have a requirement of PPO and HMO, there's certain types. It just means that there's in-network and out-of-network differences. And those are just ways to categorize. We just say that there's 4 plans, high deductible down to low deductible, and choose what your options are. One acts like a high deductible is going to act more like a PPO, and a low deductible is going to act more like an HMO, but give you less options, give you less provider options.
Yes. And see, where I'm at, I live out in the panhandle of Oklahoma, very sparsely populated, And insurance companies like to say, well, you're in Oklahoma, you need to go to Oklahoma City. Oklahoma City is 6 hours. It's hours away. Where really we need
Take your private jet.
We need to go.
What is it by private jet?
I don't know. I don't have one yet. But
It's on order.
We normally go to Amarillo, so that's 90 miles. So we actually jump state lines, and so in the weird insurance scheme, we need something that we could go to Kansas, Texas, where we can go to our doctors who are in our region, maybe, but not in our state.
Well, make sure your better half asks that question.
Oh, she will.
During the enroll process.
Very much so. I don't doubt that.
So one area I know Jerod and I are both pretty passionate about is mental health. And there are, in corporations and companies, they tend to offer insurance, but they also tend to offer a program of wellness. And you get, discounts to, go to gyms or fitness places or things like that. What is going to be concentrated on, or how are you going to concentrate on mental health?
Yeah, a couple things. So when we first launched here, it's really straightforward and basic, simple. We do have a 24/7 phone line that you can reach out telephonically and get to the right generalist or specialist to support if you have any urgent issues, that kind of stuff. We're looking at trying to expand that. There's people, the VAs here. We have other parties that say, hey, we want to work with you on education. Obviously, our plan wants to bring in other providers. So we want to figure out how we can provide not only just education, right? We did a panel on rural health and specifically had Ted Matthews talk about mental health a little bit. We want to figure out, we don't have the answer yet, but we want to have a special concentration on mental health. And really it's about prevention and that kind of stuff. And so any feedback, we're willing to work with different parties, and our plan partners help us, because anytime we had a mental health offering, nobody really used it because it wasn't coordinated, there wasn't education people. So we're trying to break down the stigma of don't say it, we're too tough to talk about it. And I love all the stuff that's going on in social media and everything that's saying listen, guys, stress is stress. It happens to us all. And so I think between telemedicine, having the right hotline, having the right telephones, the VA does a lot of things around suicide prevention and having a support structure. We can figure out what that looks like. And quite honestly, it's not going to be me. It's not going to be FBN that's going to actually deliver this service, right? We're not going to get into the mental health service delivery, but we can bring the right providers and the right solutions, tools, so that farmers know that quickly, I know where to go. I know what to do. I can see the signs.
I'm not alone.
This was part of the conversation. So when we do Farmer to Farmer, it's part of the conversation. When we do our summer clinics, we're going to talk about it. We might talk 2 hours about seed and chemicals and this and that, but we're going to talk 5 minutes at the end to say, remember, this is there. This is the number. This is the hotline. So that people are like, yeah, I get it. All right, I'll put it in my phone. That's the kind of thing we want to do.
Excellent. So where do people need to go if they want to investigate or get some more information about the health program?
The easiest way is to simply go to the website. It's FBNHealth.com. There's a phone number there. There's also an online application, and there's some additional information. Go to that website. That is run by our partners. They will answer the phones. They'll take care of you. Go to FBNHealth.com.
And Jerod, did you have any last questions that you would like to ask?
Is there a discount for being at Farmer to Farmer on the insurance yet?
There is not yet, just like that private jet. Yeah.
Yes. No, that's it. Thank you.
Very good. Well, thank you, Jerod. Thank you, Lucas. I appreciate it. And give us your social media channels if people want to find out information about Farmers Business Network.
Give us at FBN Farmers on Twitter. We have a Facebook page. Just search it, because I'm not actually sure what it is.
I caught you off guard.
Yeah.
I didn't warn you about that.
No, that's
one.
all right. And yeah, I'm not as good as you guys with that. But find us. Google us.
And Jerod, how can people find you?
Just basically go to Twitter at Jerod McDaniel, or you have to use a hashtag Ag Uncensored, because I've got an Ag Uncensored website, but it looks like I made it. So it's.
Did you make it?
Yeah, I made it on Squarespace, and my 3-year-old could have done a better job. So that's That
sure
or
it's
look,
fine.
iTunes or whatever. I guess all the podcast platforms
And
should
what's
be
your
Ag
cell
Uncensored.
phone number?
My cell phone number is edit. Yeah. And
Scene.
every telemarketer can tell you my cell phone number. I promise you that.
They've got it.
They've got it, and they share it with all their buddies.
Heck, that could be a whole nother episode.
It
we
really
could talk
could.
about that.
Yeah.
So, well, we'll wrap this up, and thank you both again. And I hope that people, take the time to go out and investigate. Like I said, being here at this event, it's kind of clicked for me where I understand what this is about now. So,
Well, thank you.
Awesome.
Thank you, everyone, for joining. For more information, go to www.keepingagreal.com. And until next time, keep it real.
Outstanding.
What app do you use to do that? Because I've always tried to figure out how to use a phone.